So coronavirus cases are increasing in the UP. The New York Times lists Iron County as one of the nation's hot spots right now. Is that on your radar, and do you have plans to address that?
Well, it is on the radar, and I have been signaling for a few weeks that we're closely watching what's going on in the Upper Peninsula. You know, one of the great things about the UP is that people don't live in close quarters. It is a beautiful place to be out of doors, especially during the summer months. But we also know that it is a destination for people from other parts of the state and country. We know that their hospital systems are not equipped to handle a massive outbreak, and that's why we've been so mindful about re-engagement and watching the numbers so closely. So I am concerned. I know that Houghton is also a place where we are seeing a lot of numbers, and I'm not sure that masking is as culturally frequent as it is in lower parts of Michigan, and so that's something that we really need to improve on. One of my concerns is if the numbers continue to grow, that we may have to take a step backwards, and I'm trying to avoid that by giving people the information and tools they need to stay safe and to keep this economy engaged. And yet, if the numbers continue to grow, that may have to happen, and that's what we're trying to avoid.
When you say step backward, are you referring to the My Safe Start phases that you've implemented?
I am. We've always known that we would have to be incremental in terms of our re-engagement, but also in terms of our disengagement. Early on, when the virus was growing exponentially and we had little information about it, and it was spreading so quickly and with such devastating outcomes, so many deaths, we had to shut everything down. And as we re-engaged, I always said, if we're going to think about this as a dial, we're going to turn it, see how it goes, turn it again if we don't see community spread. We've been really successful at that. We are leading the country when it comes to the re-engagement of our economy. We're leading the country when it comes to the number of tests that we're doing. We're leading the country when it comes to percent positivity. But we do have parts of our state that are growingly concerning. And so if we have to turn that dial backwards a little bit, we will. And that's what I'm hopeful not to have to do. And that's why we really need these communities where there is spread and where there is growth to step up, double down on masks and not congregate and be smart. We know how to do it. The question is, are we going to?
Well, what's it take to turn that dial for you? Like, what metrics are you watching? I know that, for instance, Ingham County saw a big spike in cases with the students returning. Obviously, we just talked about the UP. So it seems like it's not case numbers alone. Is that correct?
That's right, because case numbers alone, that's an important data point, but that's not everything. Hospitalizations, that's an important data point, but that's not everything. Fatality rates, important, but not everything. We're learning a great deal about the epidemiology of this virus. We are making huge strides in the production of therapeutics and the creation of vaccines. I'm really hopeful that we will have, while there are 9 companies, I think, that are in human trials right now with a vaccine, that a handful of them will have efficacy and be safe and that we can move forward. And so there are a lot of different moving factors that impact when it's safe to come out of a state of emergency, that impact when it's safe to drop our guard. We're not there yet, unfortunately, but with the quick speed at which a lot of these things are happening, I think that it really is a matter of months. And that's why we've got to do what we know to be the best tool we still have against this virus, and that's a mask. It's that simple. And we've heard everyone from the people in the Trump administration to Dr. J reiterate that simple act of masking up can keep us safe and our families and our communities and our economy going.